Hi, let's talk about lung cancer. This exemplar falls under the concept of cellular regulation, just like all the other cancers. Cellular regulation is the idea that, the cell is the basic structure of the human body. It forms clusters into organs, organ systems, and then organisms. Those cells form specialized purposes in the body, and they, divide and die at predictable rates. With cancer, that is not happening. The cells mutate, they don't serve a purpose, and then they divide rapidly and can lead to a lot of damage, even death in the body. Big example of that is lung cancer. This is the second most common type of cancer in men and women, but it's the number one cause of cancer death in the U.S. for both women and men. So this is a pretty high mortality cancer. Unfortunately, that's because so often it's diagnosed pretty late in the game and has already metastasized by the time we are diagnosing it. So of course it's that uncontrolled growth. There's two different types of lung cancer, non-small cell and small cell. So the biggest risk factor is still smoking. 90% of cases are directly linked to smoking. The incidence of smoking has gone down. But the incidence of vaping has gone up, so there's not a whole lot of data yet to link cancer to vaping, but I'm sure we'll find out more about that in the next, couple of decades. Secondhand smoke is also a risk factor, radon exposure, pollutants, asbestos, and the incidence does increase with age. So the clinical manifestations are that new cough that won't go away, or any changes to a cough that you already had. Hemoptysis which is coughing up blood. That's probably the one symptom that's different from COPD. So unfortunately, if we have a smoker and they already have COPD, they already have a lot of these symptoms, which is why it's caught so late. But hemoptysis is the one symptom that's not expected with COPD. So if they start coughing up blood, then we know something else is going on. They can also have that shortness of breath, wheezing, hoarseness, chest pain. Weight loss is a classic symptom of all cancers. And then they have this constant pneumonia and bronchitis. Once there's been metastasis to bone and brain, they may also experience bone pain or headaches. So a lot of times we diagnose this. First we'll see something on a CT, a chest x-ray, or PET scan. Then they can do a bronchoscopy or get a sputum sample and get some of those cells and look at them under a microscope. They may also do bone and abdominal scans because, like I said, this is caught so late that often it's already metastasized to other areas. So treatment, of course we can do radiation and chemotherapy. This can be very painful, so we may also need to do some pain management. And then if it's not spread already, we may be able to do surgical interventions like a lobectomy, where we're removing the lobe where that cancer has been found. We may do a pneumonectomy, which is removal of an entire lung, or just a resection of a lobe where we're just taking out the portion that has the cancer in it. But if you think about somebody that already has COPD and now we're taking out entire lobes and entire sections of lung, that's going to lead to even more shortness of breath. So it really decreases the quality of life for this person. So this person's probably going to need oxygen. There's going to be a lot of weight loss because of the chemotherapy and the cancer, so we need to make sure they're getting enough nutrition. They're going to have probably a lot of shortness of breath, so think about, all the things you would do for somebody that's having shortness of breath sitting up, making sure that you're checking their pulse ox, teaching them some breathing techniques. They may have a lot of anxiety because when you can't breathe, you get very anxious. So we may need to help treat that too. They're going to have to pace their activities so they don't get too short of breath. And then definitely if they're still smoking, we need to try to get them to stop smoking. But, quitting smoking is very, very difficult. So they're going to need a lot of help and encouragement with that. So make sure you're doing your readings. This is just a really short overview of lung cancer. So do your readings and come to class prepared so that we can discuss this a little bit further.